Welcome to another video. In this video, we will continue learning mental health nursing starting with anxiety and anxiety disorders. Anxiety is a universal human experience that is considered the most basic of human emotions. There are different levels of anxiety that is crucial to know for exams. Let's first learn about mild. This is a normal experience of everyday life and promotes a sharp focus of reality. Manifestations are heightened perceptual field, alert and can grasp what is going on, restless, irritable or impatient, foot or finger tapping. Nursing actions include the following. Help the client identify anxiety. Anticipate anxiety-provoking situations. Moderate level. This is a narrowing of a perceptual field, and some details become excluded. Manifestations are narrowed perceptual field, voice tremors, difficulty concentrating, increased respiratory and heart rate, pacing, banging hands on table. Nursing actions include the following. Demonstrate interest in the client by leaning forward and maintaining eye contact. Ask questions to clarify what was said. Encourage problem solving. Severe level. This is a severely narrowed perceptual field, and the right amount of focus on detail is lost. Manifestations are greatly reduced perceptual field, problem solving feels impossible, feeling of dread, confusion, chest discomfort, diaphoresis, loud and rapid speech, threats and demands. Nursing actions include the following. Maintain a calm manner. Remain with the client. Minimize environmental stimuli. Use clear, simple statements. Panic level. This is the extreme level of anxiety, leaves a person unable to process the environment. Manifestations are that the patient will be unable to focus on the environment, may feel unreal, cannot process what is happening, hallucinations or delusions may occur, somatic reports increased. Nursing actions include the following. Use a low-pitch voice. Listen for themes and communication. Attend to physical and safety needs. Now let's learn more about anxiety obsessive-compulsive disorders. Clients who have anxiety disorders use ineffective behaviors to try to control their anxiety. There are many different types of anxiety disorders. We will learn about the main ones focused for exams, starting with phobias. This is an irrational fear of an object or situation that persists. It is associated with panic-level anxiety if the object, situation, or activity cannot be avoided. Defense mechanisms commonly used include repression and displacement. We will learn more about defense mechanisms in a moment. Here are examples of different phobias. Hematophobia, fear of blood. Hydrophobia, fear of water. Monophobia, fear of being alone. Mysophobia, fear of dirt or germs. Panic disorder. Panic attacks are the most commonly seen feature of this disorder. Panic attacks are characterized as a sudden onset of extreme apprehension or fear usually associated with impending doom. Obsessive-compulsive disorder. Obsessions are thoughts, impulses, or images of process and cannot be dismissed from mind even though the individual makes attempts to do so. Compulsions are ritualistic behaviors an individual feels driven to perform to attempt a reduction of anxiety. Obsessions and compulsions often occur together and the rituals become time-consuming, interfering with normal routines and relationships. Generalized anxiety disorder. This is characterized by excessive anxiety or worry about numerous situations, and the anxiety is out of proportion to the true impact of the event. Separation anxiety disorder. This is a normal part of early development, but it should not continue into adulthood. This is when a person displays an inappropriate level of concern over being away from a significant other. Medications for anxiety disorders are the following. Antidepressants such as selective serotonin reuptake inhibitors. Commonly used antidepressants of this class are citalopram, fluoxetine, sertraline, serotonin norepinephrine reuptake inhibitors. Commonly used medications of this class are venlafaxine, duloxetine and tricyclics such as imipramine, amitriptyline. Anti-anxiety agents such as benzodiazepines. Commonly used anti-anxiety agents of this class are alprazolam, clonazepam, diazepam. Another anti-anxiety agent are non-benzodiazepines such as buspirone. The last type of medication class to know are anticonvulsants such as gabapentin. Defense mechanisms. These are automatic coping styles that protect individuals for anxiety and maintain self-image. Adaptive use allows anxiety to be lowered and goals to be achieved. This is healthy. Maladaptive use occurs when one or several are used in excess, disallowing the goal is to be achieved. This is unhealthy. Defense mechanisms. Denial. Denial is the attempt to escape unpleasant realities. Adaptive. Client states, "I can't believe this," when hearing news that the loved one died. Maladaptive. A woman who lost her young child 7 years ago keeps their clothes hanging in the closet and talks about them in the present tense. Projection. Projection is the unconscious rejection of emotionally unacceptable futures and attributing them to others. Adaptive. This is considered an immature defense mechanism and there is no adaptive example. Maladaptive. Amanda has a strong dislike for someone. Amanda might instead believe that they do not like her. Regression. Regression is reverting to an earlier developmental level. Adaptive. A 5-year-old begins sucking his thumb when a new sibling is born. Maladaptive. An employee who is not promoted after asking for a promotion begins missing appointments and showing up late for meetings. Sublimation. Sublimation is directing unacceptable behaviors into a socially acceptable area. This is always adaptive. Example. The student who is angry with a family member writes a short story of a hero. Well, that's it for this video. In the next video, we will continue the lesson by learning about schizophrenia. Thanks for watching. If you found this video useful, please comment, like, and subscribe to help.